Hi, I'm Dr. Shawn Anthony. I'm a shoulder, knee, and sports surgeon at Mount Sinai.
Thanks for joining us live from the U.S. Open, Dr. Anthony. Today we want to talk about the meniscus. What is the meniscus and what does it do?
The meniscus is a structure in the knee. It's made of fibrocartilage, almost like a rubbery substance. And its main purpose is to serve as a cushion between the cartilage surfaces in the knee.
And how can someone injure their meniscus?
A meniscus can be torn in different ways. It can be a twisting injury, is most common, or it can be a degenerative tear that happens slowly over time.
And what are the signs and symptoms of a meniscus injury?
The most common signs and symptoms of a meniscus injury are pain, swelling in the joint, difficulty bending the knee. There can also be some mechanical symptoms like clicking, catching, locking, or even buckling or instability.
And how does an injury get diagnosed?
A torn meniscus is diagnosed by seeing an orthopedic surgeon first based on the physical exam. We're looking for some telltale signs such as joint swelling, tenderness along the joint line, difficulty with range of motion, and then there are also some special tests that we can do to further aid in diagnosis.
And how can you treat the injury?
The injury can be treated, a torn meniscus can be treated depending on the size and severity of the tear. Sometimes degenerative tears that can happen over time are treated best with rest, ice, anti-inflammatories, and of course with physical therapy. Other times the tear is in such a configuration that it's best to treat surgically, and that can be an outpatient procedure ranging from 15 to 30 minutes in which we repair or take out the torn pieces of the meniscus.
So what is the recovery process like for non-operative treatment for a torn meniscus?
Non-operative management of torn meniscus can take several weeks for the swelling to resolve and for flexibility and strengthening of the knee.
And what if you get surgical treatment? What is the recovery process for the patient then?
The recovery from a surgery on a meniscus is somewhat variable depending on the size and complexity of the surgery. Often it's cleaning up the tear in the meniscus, which could be a 15-minute procedure in which the patient feels better when they take the first 2 steps in the recovery room. Other times that are more complex that involve suture repairs of the meniscus, the patient may have to use crutches for an extended period, even up to 6 weeks.
Is there any other interesting facts about meniscus or injuries that you'd like to share for our audience today?
I think a really important thing for patients to understand is that having knee surgery or meniscus surgery does not increase the risk of osteoarthritis or loss of cartilage in the knee. Many patients that I see are very afraid to have surgery because they have friends and family, or maybe they read online that having surgery will cause arthritis, and that's just absolutely not true. That's one of the myths on the internet. And by having proper treatment of meniscus tear, it actually aids in joint preservation. Our overall goal is to preserve the cartilage in the knee.
Great, thank you so much for joining us today live from the U.S. Open.
Thank you.